story highlights saline is commonly given through and for to replenish fluids in the hospital. Studies showed that saline was linked to worse outcomes than another common for fluid, CNN. Replacing the saline in many 4 bags with another solution could save lives, according to 2 studies published Tuesday in the New England Journal of Medicine. The sister studies, one on patients in the intensive care unit and one on adults who were not critically ill, showed that balanced crystalloids, solutions that are more similar to what's in human blood, were less likely to result in major kidney problems in the month after they were enrolled in the study. ICU patients on these fluids in the hospital also died at lower rates within the 30 days. The study authors said that making the switch could save tens of thousands of lives among the millions who get these fluids in the hospital every year. Saline has been used in practice for over a century, said study author Dr. Todd W. Rice, director of the Medical Intensive Care Unit at Vanderbilt University Medical Center and an associate professor of medicine in its Division of Allergy, Pulmonary, and Critical Care Medicine. Photos, 10 medical advances in the last 10 years. Photos, 10 medical advances in the last 10 years. 10 breakthrough medical advances. The speed of science is often excruciatingly slow. But over the last decade we've made significant strides in medical research, disease treatment and the improvement of patients' quality of life. Whether it's a change in public policy or one of the largest scientific undertakings in history, these 10 advances have affected medicine in a big way. Hide Caption. One of 11 photos, 10 medical advances in the last 10 years. Human Genome Project. In April 2003, scientists announced they had completed a draft sequencing of the human genome, or all the genes that make up our DNA. This established the order of the more than 3 billion letters in what's often called the Book of Life. Gene sequencing has helped researchers identify single genes that cause diseases and, in turn, has aided in creating better treatments. Scientists are now working on the Human Microbiome Project in hopes of better understanding the complex bacterial systems that live in and on our bodies. Hide Caption. 2 of 11 photos, 10 medical advances in the last 10 years. Stem cell research. Stem cells can essentially be programmed to become any type of cell in the body. As such, researchers say they have enormous potential for curing diseases and repairing damaged tissues. In 2006, scientists showed that adult cells, including skin cells, can be turned back into stem cells, which are called induced pluripotent stem cells. Scientists have also cloned human stem cells and have made promising developments in stem cell therapies for heart repair and eye disease. Learn more here.Hide Caption. 3 of 11 photos, 10 medical advances in the last 10 years. yearsHIV cocktails. Treating HIV used to require a complex regimen of medications, a schedule that was difficult to adhere to, especially for people in developing nations. a triplet change that by combining 3 antiretroviral drugs into one daily cocktail pill. The FDA approved a triplet in 2006. In 2013, Gilead Sciences received approval to sell its Stribital pill, which combines 4 HIV medications into one dose. Hide Caption 4 of 11 photos, 10 medical advances in the last 10 years. Targeted cancer therapies. Targeted cancer therapies are drugs that usually work in one of two ways. They either interfere with the spread of cancer by blocking cells involved in tumor growth, or they identify and kill the deadly cancer cells. These therapies are much more direct than treatments like chemotherapy or radiation, which also attack healthy cells. Targeted therapies have been the focus of cancer research over the last decade. More than 25 drugs have been approved by the FDA. Eventually, treatments may be individualized based on the unique set of molecular targets produced by the patient's tumor, the National Cancer Institute says. Hide Caption 5 of 11 photos, 10 medical advances in the last 10 years. Laparoscopic surgery, better known as minimally invasive surgery. Laparoscopic surgery has become the norm for many operations, including gallbladder removal, hernia repair and appendectomies. Patients who undergo laparoscopic procedures generally endure less pain, smaller scars and a shorter recovery time. Up next for surgeons? An increase in natural orifice procedures, where surgeries are performed through an opening like your mouth or anus. Hide Caption 6 of 11 photos, 10 medical advances in the last 10 years. Smoke-free laws. In 2003, there were only 75 cities in the United States with laws that prohibited smoking in workplaces, restaurants and bars. By 2013 that number had topped 560. There are now 28 states that ban smoking in these indoor areas, although some exclude casinos, private clubs and tobacconists. Smoke-free laws substantially improve indoor air quality, reduce secondhand smoke exposure and related health problems among non-smokers, help smokers quit, change social norms regarding the acceptability of smoking, and reduce heart attack and asthma hospitalizations, the CDC says. Hide Caption 7 of 11 photos, 10 medical advances in the last 10 years. Vaccine. The FDA approved the first human papillomavirus vaccine, called Gardasil, in 2006. The vaccine is delivered in 3 injections over 6 months and protects against 4 HPV strains that can trigger cervical cancer and genital warts. However, research shows only half of girls ages 13 through 17 received at least one dose of the vaccine in 2010. HPV-related cancers remain elevated despite the vaccine's existence. Hide Caption 8 of 11 photos, 10 medical advances in the last 10 years. Face transplants. The first partial face transplant was done in Amiens, France, in 2005. Five years later, doctors in Spain completed the world's first full face transplant on a man who severely damaged his face in an accident, giving him a new nose, lips, teeth and cheekbones during 24 hours of surgery. The first full-face transplant done in the United States was performed on Connie Culp, seen here, in 2008. Hide Caption 9 of 11 photos, 10 medical advances in the last 10 years. Fewer periods. Birth control packages traditionally supply hormone pills for 21 days and placebo pills for 7, bringing a period once a month. But in 2003, the FDA approved Seasonal, a new kind of birth control that enabled women to have full periods only 4 times a year. In 2007, the FDA approved Liberal, the first oral contraceptive designed to stop a woman's period indefinitely. With these drugs on the market, women now have more choices when it comes to when, or if, they have a monthly cycle. Hide Caption 10 of 11 photos, 10 medical advances in the last 10 years. Bionic Limbs. Last year doctors amputated Amy Copeland's hands, leg and foot after a flesh-eating bacteria threatened her life. This month, she showed off her new bionic hands, which can be positioned using an iPad app. Amputees are living life to the fullest, thanks to advances in prosthetics. From computer chips that sync joints, to Bluetooth devices that coordinate movement, to 3D computer models that customize socket designs, new technology has helped these limbs feel as real as possible. Hide Caption 11 of 11. We actually heard from a number of people that there couldn't have been much difference between these two intravenous fluids, because we would have already known it if there was. Read more of nearly 16,000 critically ill patients, 10.3% of those given balanced crystalloids and 1% of those given saline died in the hospital within a month. Serious kidney events arose in 14. .3% of the balanced group and 15.4% in the saline group. On the other hand, the study of more than 13,000 patients who were not critically ill found that there was no difference in how early surviving patients were discharged in the 4 weeks after they came to the emergency room. But the researchers did find a slightly lower incidence of serious kidney events, 4.7% for the balanced group versus 5.6% for those receiving saline. This means 111 saline patients would need to be treated with balanced crystalloids instead in order to prevent one adverse kidney event. Though these numbers may be substantial when looking at the country as a whole, Rice said it's not a reason to worry for an individual who finds themselves attached to a saline drip. For any one patient, the risk is pretty small, he said. 4 bags can contain any number of ingredients, such as fluids, sugars and medications. But many patients are dehydrated, and that's where saline and lactated ringers, the most common balanced crystalloid, come in handy. We've tried to do a lot of history looking to figure out why saline became the default, Rice said. It's not entirely clear. Neither fluid tends to cost more than the other, and both have been widely available for decades, the researchers said. These fluids are meant to mirror salt concentrations in human blood, keeping water where it needs to be in order to better hydrate the body, according to Rice. This is partly why chicken soup is often recommended for those who are sick, experts say. Saline consists of sodium chloride, the main ingredient in common table salt, dissolved in water. Lactated drinkers contain several additional ions, such as calcium and potassium. Research has suggested that a higher chloride concentration in saline can affect kidney function and lead to metabolic problems. However, a couple of smaller studies recently failed to show a difference between the two fluids, Rice said. This study makes me think again about what choice of fluids I'll use now, said Drive. David Hogger, Associate Director of the Medical ICU at the Johns Hopkins Hospital. Hogger was not involved in the new studies. Hogger said he believes that other studies will spin off from this research, which was conducted at a single medical center. He also noted that the research was unblinded, meaning that doctors knew they were giving one fluid versus another, and that may have an impact on other decisions that they make. Patients who were not critically ill, who received 4 fluids in the emergency room, did not necessarily receive the same fluid after being admitted to the hospital, the researchers said. That was actually quite a surprise to us, Rice said, and this could be because some patients receive the majority of these 4 fluids in the emergency department. It could also have something to do with being more vulnerable in the early stages of an illness, he said. Follow CNN Health on Facebook and Twitter. See the latest news and share your comments with CNN Health on Facebook and Twitter. Doctors may still opt for saline if, for example, a patient has low concentrations of sodium or chloride, Rice said. Many of his colleagues who treat brain injuries are also wary of using lactated drinkers over saline because of its potential impact on the pressure within the skull, he added. They get very worried about increased swelling, Rice said. More research could uncover which types of patients are most sensitive to the effect of one fluid over another, he said. Though Vanderbilt's hospital system has made changes to prioritize the balanced crystalloid, Rice said it could be a long time before this becomes standard practice. Change is slow in medicine, slower than any of us believe it should be, he said. We're trying to get the message out.